Hello, I'm Jim Thomas, an epidemiologist and ethicist with the Gillings School of Global Public Health at the University of North Carolina. I'm going to be talking with you here about the intersection of public health law and ethics. I'm speaking here with Don Hunter, a lawyer with the Network for Public Health Law. Thank you, Don, for joining me. And can you tell me, what is the Network for Public Health Law? What is their mission?
Yeah, the mission of the Network for Public Health Law is to provide leadership and support in the use of law to protect, promote, and improve public health and health equity. So what we do is we provide nonpartisan legal technical assistance and resources, and that comes in the forms of research and analysis, strategic consulting and guidance, knowledge and skills building. So we do a lot of trainings and workshops, and raising awareness and connecting people to other practitioners and experts. And we do this work across sectors, and we ultimately hope really to expand the understanding and use of practical legal and policy solutions.
Okay, so it really is a networking function that it serves. Yeah,
it is. Yeah, and so we often get requests from people on issues. Either they're not within the realm of our expertise or one of the attorneys in the network, or there are things that we don't do. For example, we don't engage in advocacy, but we're able to help connect people, requesters, to the kind of expertise that they're looking for. So that's one of the functions that we serve.
Okay, so within that network of people, there are public health practitioners, and can you tell me which of them, who among them, has legal authority to make legal decisions that affect public health?
So yeah, at a very high level, when we think about who has ultimate public health authority at the state level, that's the governor and his or her appointee to the state health officer position. At the local level, that might be a board of health or the local health officer. And these are the people who can inform and guide the creation and development of laws. Ultimately, the legislature, state and local legislative bodies pass laws that impact public health. And so we've actually seen that a lot during the pandemic, where we see municipalities and counties having to make legal decisions about all the recommended public health guidance and how to best implement them in their jurisdictions. But I also like to say, even though we as people and as practitioners don't have authority to make law necessarily, that we all have legal authority as public health practitioners. And what I mean by that is that there are laws and policies that guide every aspect of our work. So if you're a WIC program manager, if you're the state epidemiologist, if you're in a tobacco control program, there are very clear laws and regulations that you and your staff are following to implement public health programs. And so, at a very basic level, I like to share this because I think we think everyone needs to understand the law that influences public health. And so one of our goals at the network is actually to help train not just lawyers, but the entire public health workforce on the role of law and policy in shaping the public's health.
Okay. It is said that within those public health laws, that public health has so-called police powers. What are they?
Yeah, so state police powers are these really broad powers to promote the general welfare of society. So these are just inherent powers that the states have that have been reserved to them under the 10th Amendment. And they're pretty broad powers to protect the health, safety, and welfare of the people. It doesn't refer to policing in the sense that we think of policing in modern times. It's really about the authority of our government at the state level to take action to protect us.
Okay. But now I'm going to take that literal understanding of police. You have just said that it's not a literal interpretation, but I'm going to take that literal interpretation and I'm going to ask about policing. We hear not infrequently about violent interactions between police and people of color. And I'd like to hear what you have to say about that as a public health issue.
So I do think when I think about violence and policing and I think about it as a public health issue, one is I would say the immediate and obvious connection most people probably note or should note is that after the murder of George Floyd, which gave rise to the racial justice movement of the summer of 2020, it also coincided with, what we were observing early on in the pandemic in terms of disparate outcomes for people of color, due to COVID, that there's a very clear connection between, race and race-based outcomes in health. And so when I think about violence and policing as an example, it makes me go to thinking about the institutions that we interact with. So violence and trauma that we experience in any of the systems that we interact with, whether it's policing, whether it's in the education system, whether it's in healthcare, those are all things that have long-term negative effects on us. They create chronic stress and trauma. They lead to greater chance of chronic illness. They, in the communities of color, lead to higher premature mortality rates, lower life expectancy. So I think it's important for us to be conscious of the fact that all these systems that affect where we live, where we work, where we play, where we learn, the events and interactions we experience within those systems ultimately affect, how long we live and how well we live. So that's what I think of, and I think that's why we also look at these as points of intervention for how we can improve health outcomes.
Can you tell me an example of a public health law that addresses racism that keeps it in check?
Well, I don't know that there is a law that keeps racism in check necessarily. So I like to think of, one of the things I share when I do trainings is we talk about the different levels of racism. So that it's interpersonal level, at the institutional level, and at the systems level. And I think it's important to have laws that affect each of those levels. So when we think about interpersonal racism, that can come out as the racism that you might experience from a healthcare provider. And it may not be explicit, right, in its expression. It might just be because of that medical provider's training, that they interact with you in a way that devalues your experience as a person of color or as part of another population or group that's been marginalized. And so having laws in place that require cultural competency training or cultural humility training or understanding trauma-informed care are really important. But also having laws at the institutional level that look at broader requirements for the workforce, that also look at the composition of the workforce. So whether or not you have people who reflect the people you serve, not just on your team, but in positions of leadership, the way your board is structured, the way people are people paid equitably in your organization? Because that also affects who gets to be in positions of power and authority and decision-making over the kinds of things that are going to impact the population that you serve. And at the systems level, this is about law, the way all these institutions interact with each other. So are there laws that we can put into place that interact with these entire systems? One of my favorite that I like to share is the Civil Rights Act of 1964. So we know that, when that was passed, that there was a pretty huge, there's this great study actually on this, and I don't remember the name of it exactly off the top of my head, but there's a huge study about the impact on Black, white infant mortality rates during that time period. And so we know that this law was intentionally designed to reduce discrimination in the provision of healthcare services for facilities receiving federal dollars, right? And so we knew that segregated care was rampant during this time and that access to quality care for people of color was much lower. And what we saw after that law was implemented was that, across all these healthcare institutions, what we saw is a decrease in the infant mortality rate and a closure, although not enough, of course, of the Black-white disparity gap in infant mortality. It's still something that we need to work on today. Because that disparity still exists, but that's a great example of a law. But another one that has a similar impact that, I don't think anyone would say was explicitly designed to address infant mortality specifically, or maybe even racial disparity specifically, is Medicaid expansion. So we do know that in states that expanded Medicaid, they have lower infant mortality rates. They have better health outcomes and lower premature mortality rates for people of color. There are a lot of great studies showing greater economic stability for populations in those states where Medicaid was expanded. And that matters, for health outcomes, of course, in terms of, how you have the resources to meet your own needs for health and well-being. So I think those are great examples because I think, sometimes people might think you have to have a law that explicitly calls out racism or says something about race and equity in it. And that isn't necessarily true if the law, is designed to have this effect that is going to improve outcomes for these populations. I don't know that it necessarily has to explicitly say, this law is designed to address the racism in this particular system.
Right. So one of the things that you've done there is that you've helped us to see the difference between explicit public health law, of which there are some that are dealing precisely with, what can be done in a pandemic, for example. And you've broadened it to address law as it affects the systems that we live in and affects the health of the public, and particularly those laws that affect the publics, the subgroups within a population, perhaps identified by race or by gender. So we can see in what you've said that broader perspective on public health and law. Is there a law that you wish existed to address something within race or racism that would relate to public health?
So I probably will think on this, and then, in 2 days from now, I'll probably have a lot of great answers, I'm sure. But in this particular moment, what comes to mind is what I wish is that we could have more consistent adoption of laws that address the things that we know have created racial disparities and outcomes, where we are seeing some places adopt these laws, but it's definitely not broad enough. And so a good example of that is looking at the Black-white home ownership gap. We know that's a direct result of intentional discrimination by the government against people of color in terms of being able to own housing. In certain areas, we know that created our home ownership gap, and it contributes to the racial wealth gap, because property ownership, of course, is one of the strongest, maybe if not the strongest way to build generational wealth. And then we know that is lower for people of color. So we have seen some communities like Evanston, Illinois, and I think there are a couple of places in North Carolina that have looked at a form of reparations, which I know is a strong word for people, but it's really about putting money toward remedying these past situations that we know created inequities we see today. So if I wish for anything right now, I would wish that we did more of that. I wish more communities would say, you know what? We prevented Black people and other people of color from owning homes in our community, and we want to rectify that. And we recognize that this is a benefit to our entire community by addressing this as a problem. I guess, but that also makes me say that I want to be clear that one of the things I think we have to do a very good job of, as we think about designing and implementing these laws, of articulating the benefits of addressing these racial inequities to everyone in our population. Mm-hmm. So I think one of the challenges right now is that we think about designing these solutions, and sometimes the message is, this is just about Black people, or this is just about Hispanic or Latino people, or this is just about Asian Americans. And that's not true. When we think about increasing the minimum wage, that's going to primarily benefit people of color in the workforce, but it also is going to benefit poor white people in the workforce who also are not making high wages. And it benefits our entire community when everyone is making a living wage. And so I think I just want to put that out there, because I think that is one of the challenges that people have in figuring out, how do we communicate about the ways that we can address racism through the law.
So let's take the flip side of that. I asked you about a law that you wished existed. Let me ask you about a law that exists that you would consider to be unethical. So some unethical action or behavior is encoded in the law.
So the first thing that comes to mind is actually related to some of the examples I just gave, and that would be, I think, affirmative action laws. And so the reason that I say that is because I think these are laws that are designed to take into account the fact that there are racial disparities, and tries to find a strategy, a methodology, et cetera, to address those inequalities or inequities. And, I think what we've seen happen in recent law, like recent case law in particular, is a pushback against that and saying, this is not something that is permissible. But I think that is unethical in the sense that, our code of ethics in public health in particular says that we will take into account what is in the best interest of communities, that we will use the data that we have to inform interventions that will improve the health of populations. And so I think when we have laws that intentionally, say, no, you can't do that, I think that, butts up against what we hold to value and be true in the world of public health.
Don, I want to ask you a summary question now about the relationship between law and ethics in public health. This is a huge question, but given an opportunity that you have now, how would you summarize that relationship?
So I really appreciated having a chance to kind of go back through the code of ethics that I agreed to when I finished my course of study. And I'm a certified public health practitioner. And reading through them, it made me really wonder how much our code of ethics actually influences the way that we operate. You know, is it just this thing that's aspirational that we haven't really operationalized? I kind of feel like it is, because all of the things, you know, a number of the things that are recommended about engaging communities, about using data to inform interventions, about implementing interventions in a way that is best for the community, for the physical and social environment. Are these things that we do? Yes. Do we do them consistently? Do we resource them adequately? Do we prioritize them in our strategic plans? I think the answer to that, you know, at a high level is no. And so, you know, I think when we see all these frameworks coming out now talking about what's the future of public health, what do we do post-COVID, and where do we go from here? A lot of the recommendations are exactly what are in our code of ethics. Mm-hmm. So clearly we haven't been doing them well enough. If now our response is to say, these are the things we should be doing, we should have been doing those things all along. And so I think it would be great to have this real intentional look at that code of ethics and say, you know, how does this really guide the way that we operate? And how do we assess this in our operations? But I think that's also, in public health agencies in particular, can be challenged by just the day-to-day-ness of the work, the ordinariness of your work. Because we have public health competencies, we have accreditation standards, we have a code of ethics, we have all these things that tell us how we should be doing our jobs and the way we do it, and standards to gauge our work against. But often we look at those as tasks that we have to complete. So when we think about accreditation, for example, you know, we're providing documentation to show that we interacted with the community when we created a report. But how well does that gauge whether or not the community felt value in that process and that we did something that actually improved outcomes in the community that we engaged with? I'm not sure that we have that. And so, you know, I guess what I would want people to think about is, you know, how do we really take these standards and take these codes and operationalize them in our work every day? And from a racial equity perspective, you know, Dr. Kamara Jones has said, you know, equity is not just a task, it's the way we operate. It's a framework for operation. So it's not just something we're trying to do. It's not just an outcome we're trying to achieve. It's trying to be the way that we operate. And I think when we think about ethics, same thing. It has to be the way that we operate, that we're informed by this code of ethics, and not just, you know, this aspirational set of goals that we go back to and look at from time to time.
And you see law as having a role in operationalizing those ethical aspirations?
For sure. I do think that we can look at, particularly at organizational policy. So these are kind of little p policies, that we can use those as a way to operationalize frameworks within our institutions that can help us to operate in a more ethical and equitable manner. But we can also use regulations to help us do that. And we can pass statutes to do that as well. I know one of the things that you were going to ask about, but we're not really talking about in depth on today, is human rights laws. And I'm certainly not an expert there, but I do think that's a good example of using the law to codify, you know, non-discrimination provisions across a broad class of people, depending on what's, you know, what your state statute says, broad, you know, classes of people, and saying, you know, we're going to protect these inherent rights that we have as people. So I think you can have a lot of different levels. You can have statutes, you can have regulations, you can have ordinances, you can have organizational policies. These are all ways that we can operationalize the way that we behave as people and as institutions.
This has been really helpful. I'm so glad I got this chance to talk with you. You've covered a vast area in a short time. We've only begun to touch on public health law and ethics, but it's been a wonderful beginning. Thank you for this time, and thank you for the wisdom you've shared with us.
Thank you so much for the opportunity to share some thoughts, and it's really great to connect with you today.
Thank you for listening to one of my talks on public health ethics. If you want to learn more, you can visit the resources page on my personal website, jcthomas.org.